Right now, when you look at other states, when you look at other countries, you see devastating loss. Here in Kentucky, we've already lost too much, but we are sacrificing every day to the hundreds of thousands of Kentuckians that have sacrificed their employment, to the thousands of small businesses that have sacrificed your dreams, to everybody else out there making sacrifices every day. Thank you. And I want to do everything that it takes to make sure we honor your sacrifice, that we protect you, and that we protect our most vulnerable here in Kentucky. What you are doing and your sacrifice is working. Let's make sure we keep it up. Let's make sure that we defeat this coronavirus and that as many Kentuckians as possible will still be here with us at Christmas, in the winter, as possible. That's what we're doing, and that's why we are doing it. We're going to get through this because we're going to follow the 10 steps that defeat the coronavirus. These 10 steps are the easy way every day to go through what you've got to be doing. Number one, you got to be home. Home is where you're healthy. Right now, being at home is your best chance of not getting the coronavirus, but more importantly, of not spreading it. Of not spreading it into a senior living facility where we are seeing significant growth and even death. That's where we've got to protect at all costs. Being healthy at home means that it doesn't spread to our healthcare workers who we desperately need on those front lines or our first responders. Best way to help them in donated meals, though I know they are appreciated, and keep that up, but it's being healthy at home. The number one way you can defeat the coronavirus, the number one way you can be a patriotic American and a great Kentuckian is to be healthy at home. Every contact that you reduce, every positive decision that you make helps us to get out of this, to protect more people, and it's what you can do. It's why you have control in this fight against the coronavirus. Number two, avoid crowds and gatherings. There are no exceptions to this whatsoever. Every crowd and gathering now, especially when you look at how widespread it is, spreads the coronavirus. If you are in a crowd, the coronavirus is spreading. And it may be that you think that it's not a problem for you to be in a crowd because you're making that decision. But when you leave that crowd and you spread it to somebody else, who then goes to work, spreads it to somebody else, who then goes home and their spouse works in a senior living facility, and all of a sudden we have 20 cases and multiple deaths. That's the challenge that we face here. So no crowds or gatherings at all of any type. We've got to make sure that we stay strong in that. It's why we are where we are right now. And remember, the decisions we make today impact us 2 weeks from now. Practice social distancing. Again, this is not an excuse to violate number 1 or 2. It's what happens when you do run into somebody, when you're getting groceries, when you're jogging, when you're doing any of those things, at least 6 feet apart. Know when to seek care. This is important as our cases surge, that if you are healthy but nervous, call the coronavirus hotline. If you are sick but wouldn't have otherwise sought care, call your primary care physician. But if you are truly sick, yes, go to a healthcare facility, or if you are really injured, go to a healthcare facility. kycovid19.ky.gov. It's updated every day. That's how you don't fall for these rumors that are out there. Washing your hands and disinfecting surfaces every day, multiple times a day. Apply for benefits. Remember, we are building our call center, expanding it on unemployment from 12 to 1,000. That's how we want to ultimately provide in this very difficult period. We know we're doing better than other states, but we also know that if you've been waiting, that there's no excuse. I mean, you deserve your benefits now, and we will work as hard as we can to get them to you now. Also, if you qualify, we've got to get you signed up for Medicaid. That's not just a way to make sure that you have health care. It is a way to make sure that our healthcare systems can be as healthy as they can through this crisis. Prioritize your mental health. You know, especially this weekend. Happy Passover, happy Easter weekend. It's a very special weekend. It's going to be very hard on all of us not to be, whether it's in our houses of worship or with our families or doing Easter egg hunts with a bunch of kids. That's going to be hard. But know that the sacrifice is worth it, and that we are truly honoring the sacrifice of everything people have done out there, of those hundreds of thousands of people that aren't going to work, of those businesses that had to shut their door. We are honoring your sacrifice by making sure that even this weekend when it's going to be hard, that we keep it up so that we can come out of this. And not just as one of the best states to have dealt with it, because we are right now, and that's because of you. But what it means is that we protect more of our people. We save more lives. Do not travel anywhere for any reason. We're not going to show you the maps again today of our surrounding states, but trust me, you are a whole lot safer being at home. And a lot of our hot spots in Western Kentucky, we can trace to other states. Western Kentucky's been hit really hard, especially when you look at population. And almost all of that is related to contacts from other states. And finally, report noncompliance. It helps us respond. It helps us keep you safe. So we always talk about 10 steps plus one. Fill out your census. You got plenty of time. This is actually your legal obligation as an American. This is the federal government passed it. You have to do this, but you should want to do this. It is going to help us rebound faster. And as we saw the other day, we are 18th. I don't think anybody expects us to be 18th in the country and how we're filling it out. But let's do a lot better than that. There aren't any sports on TV. This is our competition. Let's get out there and let's win it. And let's want to win it. All right. Now, I want to look at our social media. And this time of anxiety and difficulty, what we've asked you to do each and every day is to model the type of behavior that we want to see out there, to approach our duty with a sense, if we can, of joy, or at least one where we are proud. We are proud of everything we are doing to protect our fellow human being. Because let's remember, we are talking about lives. Every single day, we are talking about lives. You know, the coronavirus just went over 20,000 deaths in our country. That's more than, any single event that we could point out at different times. This is a very serious issue. So when we talk about the type of behavior we need everybody to be doing, it's because it's a truly heroic act, and it will save somebody's life, probably that you'll never meet and that you'll never know, but they'll still be here with their family. Here are the hashtags we ask people to use: Team Kentucky, Together KY, Patriot, and Healthy at Home. Let's take a look. All right. Now here are making these Easter baskets, making sure we're still celebrating, even though we are celebrating at home. As you know, the Easter Bunny is an essential worker. Will be able to travel this Easter, and I know kids all around Kentucky are looking forward to it. Next. Here is Easter service, social distancing style. Again, this is just one of our many churches, making sure that they provide that experience that is so important to all of us, but providing it in a safe way that ensures that all this congregation is also there for Christmas. That's really what we're talking about. With the way it spreads in any mass gathering, are you willing to give up 10% of a congregation, or of anything, of a Lions Club, or of a Chamber of Commerce, which I know aren't meeting? That's why we're doing this. All right, these are some of our frontline heroes. Remember, every time we are in a mass gathering, these are some of the people we put in harm's way. They're walking into situations every single day where they could get the coronavirus so that they can save lives, do everything that they can. Sometimes they're even walking into harm's way just to provide comfort to somebody as they are passing away, because that's happened 90 plus times here in Kentucky. All they're asking of us is to stay home. I think that is something that we can easily do to honor them. Next. All right. This is hanging out masks for neighbors. Again, the CDC now suggests that you wear a mask. It could be a cloth mask. These are ones being produced in Kentucky's prisons. And it's really to prevent you from spreading anything to anyone else. Now, where this really comes in handy is if you are actually sick. But our biggest concern about this new guidance is that people think that they don't have to be healthy at home or they don't have to engage in social distancing. Wearing this isn't worth it if you're gonna come to a mass gathering, or if you're gonna get together with folks at a house party or something else. So in my faith, it's one of the most important sayings, especially starting tomorrow. It's a little bit of chalk art of kids that won't be in that service, but expressing their excitement about this weekend. Chalk art and its renaissance, and I feel like that's what we're in. Has been a really special thing to see. It lifts other people up. Keep it going. So I just wanted to show this one. It's not a picture, but it's just something that this individual's going through. This was her cousin's funeral. It was actually today. But the fact that they did the procession to the grave site and stayed in their cars, that it was such, you can tell, a hard, difficult day. But just look at that last sentence. Please stay at home so fewer families will have to go through this. So when we announce our deaths, they're not just numbers. They're not just individuals that we light our houses up green for. They're families that can't even go through a normal funeral and get closure. Every death is traumatic. These, I know, are even more difficult for the family. Let's just commit to doing everything we can to make sure that other families don't have to go through this. Now we have a new video of some of our women clergy that are out there. We had put together a couple of these, and we did get the comment, and it was a absolutely accurate comment that we needed more diversity in terms of women. They were right. They were absolutely right. And without even asking, though, we had a number of these. We actually had people who sent them in on their own. So let's take a look.
Hi, I'm Reverend Julie Olt, pastor of the Cynthiana Presbyterian Church. While we may not be worshiping in our buildings right now, that doesn't mean that we're not worshiping.
I'm Catherine Doyle, rector of St. Thomas Episcopal Church in Louisville, Kentucky, and coordinator of youth and young adult ministries for the Episcopal Diocese of Kentucky. We believe that worship takes many forms and can occur in many places.
My name is Emily Allen, and I serve at Middletown United Methodist Church in Louisville. And right now, the best place that we can worship is in our homes.
I am Reverend Hannah McIntyre, pastor at Pisgah Presbyterian Church in Versailles. We can worship while out driving the beautiful country roads of Kentucky.
Hi, my name is Reverend Christy Ehlert, and I serve as a chaplain at St. Joseph Hospital in Lexington, Kentucky. And in our beautiful state, it's easy to worship when taking a socially distant walk outside.
Hi, I am the Reverend Kim Gibson Pierce, and I am the pastor at Republican Christian Church, Disciples of Christ, located in Cynthiana, Kentucky. Our faith isn't dependent upon a particular time, a particular building, or a particular place.
I'm Linda Kurtz, a pastor at First Presbyterian Church in Lexington. In these times, using the wisdom that God has given us, we will willingly worship in different places and ways than those to which we are accustomed.
My name is Delmetria Cason Combs, and I'm the pastor of the Phillips Memorial Christian Methodist Episcopal Church in Lexington, Kentucky. Our love of God and our love for our neighbors demands this of us right now.
Hi, Kentucky. My name is Melissa Bain Sevier, and I'm a Presbyterian minister who lives and works in Versailles. We will worship and be healthy at home.
My name is Miriam Taylor, and I'm the pastor of South Frankfort Presbyterian Church. This home office is where I've always prepared my sermons, and now it's where I broadcast them by online streaming and host deacons' prayer meetings online and so much more. These are just some of the ways that we can now honestly and prayerfully say, we will get through this, and we will get through this together.
I want to thank each and every one of those clergy women for providing their message. Now, we started this yesterday. One of the greatest reactions that we have seen to when we do these is the additional interest in sign language and making sure that absolutely everybody can get the information that they need. So this is the time where we switch places, and I was hoping today, unless you have another plan, that you could teach us Team Kentucky.
Hello. For Team Kentucky, go team. Now for the state of Kentucky, it's KY. So K.
Okay.
You got to work those fingers a little bit. KY.
Why?
So team. So there are two T's.
Yes.
Team.
Team.
Then Kentucky. KY.
Let's do it one more time.
Okay. Team.
Team.
Kentucky.
Kentucky.
Very good.
Thank you.
Thank you.
And let's practice what we learned yesterday, right? We will get through this together. Oh, I need to do it again. All right. We will get through this together. Thank you very much. All right, a couple of updates today. First, on the fairgrounds, and I think we have a picture. We are on our way to getting at least the first phase of our field hospital up and running. This is the work that's being done today. The plan is for the field hospital, at least in the beginning, but if not for the duration, to be staffed on the medical side by our National Guard. They are doing a wonderful job. We have 300 plus that are now deployed throughout the Commonwealth, and we are working to get this up as quickly as possible. We always had plans for it, but especially our experience helping out at Trayton Oaks let us know that we have to have a place, even if it is just temporary, to get people at a moment's notice. So we are continuing to work to get that facility up. My understanding is that the University of Kentucky is also well on its way on Nutter Fieldhouse. Next, testing. As you know, we've had a couple of announcements on testing. I expect we will have a fairly big announcement tomorrow. PPE. We're going to go through on Monday exactly how much we at the state have and go through the system on how we provide it out into the state. But there are three ways that we get this personal protective equipment that is so critical for our frontline healthcare workers. Number one is we try to buy it. We've had a little bit more success, but that is incredibly difficult out there in the Commonwealth right now. Number two, we work on manufacturing it, and we do have a number of Kentucky's companies that are working on doing that right now. We've had some real success, especially with face shields. Number three, it's donations. And let me tell you, that has gone better by far than any of the other two. You all have answered the call. We'll talk on Monday about how we have over 2 million gloves. And that's because of people in Kentucky coming together and realizing this is the highest and best use. Believing that we are a Commonwealth for the common good and that we're willing to sacrifice any stockpiles that we have. Here are your ways to give PPE. You can go to the website, you can call the number, you can take it to any of the KSP, Kentucky State Police posts, you can take it to any of the transportation Kentucky Transportation Cabinet hubs that are out there. We need you to keep it up. Every day that someone provides more PPE means that it is more likely that that healthcare professional will have what they need. So please continue to give it. Also an update on the National Guard going back. We will be by tomorrow in every area of the state with groups ready to transport patients as needed to different facilities throughout the state. The National Guard is going to handle transportation between hospitals and hospital systems. They've been working very hard to get that up and to get that running. All right, so moving to today's cases. So we're going to have another day where we have a fairly large number, and it being the weekend, the number could get a little larger through Sunday or even through Monday. You know, we are in our surge, and if you can, James, if you'll put up Philadelphia versus St. Louis, because it's the easiest way to show it. You know, even when we flatten the curve, and I will tell you, everybody in this country believes that Kentucky is flattening the curve. All the data that we've shown shows it. So while we're not doing what Philadelphia is doing, which would be, well, doubling in this graph probably every day, show St. Louis, if you will, please. What we are still, there's a period of escalation. Even when you're doing a good job, we're facing a worldwide pandemic of which there is no vaccine and didn't exist, at least to our knowledge, for 4 months ago. So this still happens. So where we are is we are in this escalation, right? And remember, that's the Spanish flu. It doesn't mean that the coronavirus will be exactly like this, but it gives us some indication of what we're up against. So today, we're announcing 185 new cases of the coronavirus. Now, again, we are going through our lists and removing people who are from other states, but we're here. You know, we're caring for whether it's people from southern Indiana or sometimes other places. And so after removal of duplicates and people from out of state, our total number of cases, the state number is 1,840. New counties that have cases: 14 for Warren County, 11 for Kenton County. Kenton County has been hit pretty hard. 9 for Boone County, 8 for Christian, 7 for Davis. Davis has been hit really hard too. 6 for Bullitt, Henderson, Jefferson, 5 for Fayette, 4 for Boyd, Caldwell, Campbell, Graves, Hardin, Hopkins, and Shelby, 3 from Bracken, Butler, Callaway, Clark, Greenup, Jessamine, Laurel, McCracken, Oldham, Pike, Whitley, and Woodford, and 2 from Barron, Grant, Jackson, McCreary, McLean, Mercer, Muhlenberg, Nelson, Rockcastle, Simpson, and Union, and 1 from Dare, Bath, Fleming, Gallatin, Grayson, Henry, Knott, Lyon, Madison, Marion, Marshall, Mason, Ohio, Pulaski, Rowan, Scott, Spencer, Todd, Trimble, Webster, and 7 we don't have the counties confirmed yet. Again, it's everywhere. It's everywhere. And one of the reasons that I keep reading the counties is so that we don't still think that this isn't in my area. And I just want to make sure that the public doesn't believe that. And I don't think you do. And I know that your local leaders, they're working really hard. They are bought in, and we really appreciate what we see out there. Toughest part of my job is announcing deaths every day. Today, we have 4 new deaths. While that is less than yesterday, it's still 4 more Kentuckians that we have lost to the coronavirus. It brings our death total up to 94. Those are 94 families, including 4 additional families today that have lost their loved one. Let's make sure we light our houses, our places of business, everything that we can up green. It's the color of compassion and of renewal, especially over this weekend. In my faith, we reaffirm that we believe that there is a better place that our soul passes on to. And for these 4 individuals, their families, and their communities, we are thinking about you. We care about you. Every loss is a loss to all Kentucky. They break down as an 87-year-old male from Boone, a 55-year-old male from Jefferson, a 79-year-old male from Davis, and a 79-year-old female from Pulaski. The racial breakdown of all cases, we know the race of 70% of those who've tested positive, and so these numbers are within that 70%. It's 81.39% white, 12% Black or African American, 2.56% Asian, 3.94% multiracial. And then when we move to the deaths, and I had that one in front of me, we know about 81% of those cases, 77.63% white, 21.05% Black or African American, 1.31% Asian. We are seeing what we are seeing in other places is a disproportionate number of deaths falling in our Black or African American communities. It, I believe, stems from an unequal access to health care, to an area where, while in Kentucky, I believe the expansion of Medicaid has helped, we have a lot more work to do, and we should have done it by now. And no one should be having to pay the price for that. I hope when we learn many lessons coming out of this, it's that everybody should have access to good, affordable health care, and making sure that they can be as healthy as they can be. A couple of specific updates on areas that we have talked about the last couple of days. Let's start with Green River Correctional Complex, where we've had an outbreak. We have 3 new cases in Green River. That is 1 inmate and 2 staff. This is how quickly it can spread in any institution. I know there are significant steps being taken there. Western State Hospital. This is another difficult area where our Secretary of CHFS is working directly. We have 7 new cases, 2 patients, 5 staff. We have not had any additional deaths, and we are thankful for that. The staff were significantly tested, just like the patients have. This is probably due to that expansion of testing primarily, but it also shows you that it can spread in a facility not just amongst those who have direct contact with patients, but it can be even staff that has only contact with other staff. Long-term care facilities, we have an increase. It is a smaller increase than some other days in residents. It's up 12 to 153 total. We have 6 additional staff, and we've had 3 additional deaths. The number of facilities impacted increased by 5. Folks, this is where the coronavirus causes the most damage, right? And it's because of contacts that people never intend to get to one of these facilities. But you never know when you break the rules, when you just really want to see people, who then they're going to see, and who they're going to see, and maybe who their kids will then see, and how that gets to someone who works in one of these facilities. The ramifications of what can happen when we increase our contacts, when we just really want to see other people right now, they end up here. They end up here. And those that are the most vulnerable, who are counting on us the most, are the ones that are harmed. So let's recommit. Let's know that every time we do the right thing, we're protecting folks in these facilities. And know that we at the state are working every single day on doing everything that we can, especially in these facilities. This is now where our commissioner of public health, Dr. Stack, spends the vast majority of his time, and we are developing even more resources to address. So with that, we will turn to questions. I forgot my watch today, so I don't know how we're doing on time. We have 3 reporters that are here today. We have Shelby Lofton and Eleanor Buckley and Philip Bailey, and I have questions that were submitted to me here as well. So we will go around and make sure that we get at least a couple questions from everybody. Shelby.
The Attorney General tweeted and said he was, quote, deeply concerned about law enforcement officers being asked to single out religious services. What is your response?
The questions about the Attorney General being concerned about what we announced yesterday, about requiring people who are going to get in mass gatherings this weekend to self-quarantine. So to our knowledge, 99.89% of all churches and all synagogues and all mosques in Kentucky have chosen to do the right thing. They are making the sacrifice, as are all of their congregants, knowing that the coronavirus will spread in any mass gathering in Kentucky. And they know it because it's been proven out there. And an Arkansas church had 30 infected and 1 death. It was their greeter. It was the person who opened the door. A California church right now has seen 70 cases come from one of the last services. In Washington State, a choir practice, just a choir practice, led to 45 cases and 2 deaths. And in Hopkins County, we now believe close to 50 cases and 6 deaths came out of one revival. I'm just doing my best to save lives. And there aren't easy answers. We have worked for weeks to get to that 99.8% number. And you know, it's other faith leaders that helped us get there. It's them calling each other. They deserve more credit than anybody else ever should. But knowing that 6 deaths from one Kentucky revival, what that can do. So right now, we only believe that there are 7 mass gatherings planned this weekend, but that'd be 42 deaths. I mean, just if the same thing happened, like happened in Hopkins County. So I'm willing to make unpopular decisions regardless of what it means for me in the future if I can save 42 people. I would give up being politically popular, which I've only been for about 3 weeks, in a nanosecond to save 42 lives. And then let's go over what choices we have. I mean, we have done everything we can, everything, to talk with people. And that's what I hear. Well, we should really talk. We've done everything we can. And to our knowledge, most of these facilities say no matter what, we're doing it. So, I know in my mind, we would have a couple options in that. One, do nothing. And the problem there is the coronavirus spreads and people die. And it's not just people who choose to go to a mass gathering, right? It's the people they then come into contact with, and they come into contact with, and they come into contact with. So how many people who have specifically chosen not to go to a mass gathering, right, end up paying for somebody else's decision? I get in people's mind if they say, well, I'm just making a decision for me, but you're not. Because if you go to work the next day and you spread it around a whole factory, well, guess what? None of them made that decision. So I guess number one, you could do nothing and let people die. Number two, I guess you could arrest a pastor. They did that in Louisiana. I don't want to do that. I absolutely don't want to do that. Number three, you could padlock doors. We're not going to do that. That's wrong too. So what decision have I made? I know people have focused on the license plate, but all I'm trying to do is to say if you're making the decision to go to a mass gathering, it shouldn't impact other people, right? Your decision should stay with you. So if you are going to put yourself at risk for getting the coronavirus, if you feel it's that important, fine. Just self-quarantine for 14 days so you can't spread it to other people. That keeps the decision with you. And I know that there are folks out there that might disagree with it, that it might sound however it sounds, but they don't have to read out the number of deaths every day. They don't have to do that. And while this is a worldwide pandemic, I feel responsible for those deaths. For better or worse, when I read them every day, I feel responsible for them. And even if it's just 42 lives, I think it's worth it. Sorry, that was a really long answer. All right, with families unable to regularly check on their loved ones and concerns related to safety of residents mounting, how does the state ensure these vulnerable Kentuckians are being properly cared for? On a good day prior to the pandemic, the family may find their loved one's care to be disappointing. Are surprise inspections made during the crisis? This is a hard one too, because we have had to limit the number of inspections because the inspector could have that coronavirus too. The fewer people that we allow outside of the regular care in any of these senior living facilities, the better we protect them. Does that potentially open it up for there to be less oversight of care? It does. It does. And I don't like it. Absolutely don't like it. But this pandemic and what it can do inside of one facility is just so significant that what we would ask is use technology, use Skype or FaceTime or Zoom. Make sure you're communicating with your loved one and get as much information from them as possible. And if you have concerns, call us. We can still do specific inspections if there is good reason. And there's what's being done to ensure elders are being cared for by companies that are not, so they're not treated as collateral damage amidst a disaster like they were by facilities at Hurricane Katrina. So that's a pretty specific question that goes to especially what happens when people stop showing up and stop staffing. And that's what we're doing through Commissioner Stack and through CHFS, making sure that we can bring people in, just like we have for volunteers down in Lyon County right now. And I will tell you that the spirits of that facility have changed since they arrived. And I don't think that that's just because of those volunteers, though I'm proud of them. It's everybody that was already there underwater working 12-hour shifts.
I know PPE is in such low supply, obviously, but is there, homeless shelters, I know the workers there haven't been provided any. Is there any hope to get those to people working with the homeless?
So the question is, with PPE in short supply, what about people that work with the homeless? And it's a good question that highlights absolutely how little PPE there is out there. When we go through our process and how it can be requested, hopefully that will provide clarity for those groups. There are also funds already under the CARE Act that are designated for them. But I will tell you that even with those funds, they will have a hard time buying PPE. I try to do it on a daily basis. So we'll work with them to do everything we can. Some of what would help the most is what can also be donated. To the extent that a mask, but maybe even a surgical mask there, and the gloves being some of the most important. Now we're going to take a look at whether what the CARES Act specifically sends to our groups that serve the homeless is enough, because we at least hope that we've got significant additional flexibility on funding. Homeless advocates did send me a very specific letter with all their asks out of the CARE Act. We're just trying to get the guidance from the CARE Act first, which is supposed to be coming in the next couple weeks. I hope it is here really soon. Kentucky long-term care, with families unable to regularly, I think I did read that. The Office of Inspector, if I can go back to checks on senior living facilities for quality, the Office of Inspector General is surveying potential complaints of immediate jeopardy, so we are continuing to do that. Department of Public Health is doing daily calls with facilities that have COVID-19 positives. Any facility that has a staff or resident who tests positive are receiving support through state and local health departments. Civil Monetary Penalty Fund is available for facilities to purchase tablets for video chatting. That's a way for some of those residents to still be able to talk about their needs. Phil.
Governor, how are you?
I'm doing okay.
Let me ask, in regards to resources, and the President of the United States recently said he's thinking about starting a second task force that he wants governors to be a part of to consider how do we bounce back from the economic downplay of the coronavirus. Number one, are you interested in serving on that panel? And even if you are or are not, what would your advice to other governors and the President be? And secondly, California Governor Gavin Newsom said that he wants to start sharing. He said he could outbid all states, given how much money California has. He suggested that governors themselves get together and talk about buying PPE and disseminate it amongst different states, smaller states like Illinois. What do you think about that?
Okay, so I want to recap the question because I can't hear you. I'll do my best. The first part is about the president's second task force that he's talking about putting together, about dealing with the resources and saying that governors would be a part. Would I be interested? If asked, I would consider it. I want to make sure that anything that I do helps Kentucky. I don't want to do anything in this process but help us. I don't care about national attention. I don't do many national shows. I want to make sure that if I had that opportunity, it would mean we could get more of what we need, more resources of what we need, more help. And if I believed that were the case, that would be something that I would do. If it would take time away but not otherwise help Kentuckians, it would be something that I would not be interested in. But what I could say is if having the opportunity to do it, it'd be done on a totally nonpartisan basis because there aren't Democrats or Republicans in this. There's only Americans versus the coronavirus. And while I and other governors of different parties have agreed or disagreed with different statements or modeling or the rest, I think we have all tried to work with the federal government as much as we can, understanding that in many ways they're in the same position that we are, dealing with a virus that didn't exist until 4 months ago. And so, as long as we're all trying every day, that hopefully we can get through it. And there was a second part of the question.
Yes, Governor Gavin Newsom from
Yes.
California.
The second part was Governor Newsom from California has suggested states get together to bid together, and would I be interested in that? Again, if we could be a significant enough part of it to where we would do better than on our own. And we have a terrible system that's set up right now where we're bidding for PPE and other things against other states, but mainly we're all bidding against the federal government and against FEMA that is either directly buying or directing it where they want it to go. If a consortium would help Kentucky have more than we can get on our own, sure, I'd be for it. If it meant we could get less, I can't do that because my duty is to our frontline workers, and that's where I'm going to focus my energy. What is the process for factories where employees are tested positive for COVID-19? Are they supposed to be shut down for a period? So this is where the new guidance from the CDC that they most recently put out on essential services comes in. They've changed it a little bit from the past. But I'm going to give you what I believe. Where there have been employees that have been tested positive for COVID-19, I believe that, and the company knows, because they don't always, there's communication back and forth. First thing, I think that there is a duty to communicate with coworkers that come directly in contact with them. I think that is just the basic that people deserve, and that those folks need to be either tested or monitored or potentially self-quarantine, though the new guidance doesn't require that in the same ways as before. I think there has to be significant cleaning, and that determines the amount of time that something would be down. I also think that every time that there is one, you have to look at your process and can we spread people out more? Can we abide by the CDC guidelines better? I think all of those are important, but that new guidance, I believe, is or will be up on kycovid19.ky.gov. Shelby.
In our newsroom, we've been hearing about COVID reactivating in people that have already recovered from it. Are you or Dr. Staff aware of that happening in our area in the state?
In Shelby's newsroom, they've heard reports about people who are maybe getting COVID-19 again. I'm not aware of that. I will say that there's been a lot of talk about levels of immunity that people might have after going through it, and none of that's proven yet. None of it. I'm excited about these stories that I hear. It could be on plasma, that plasma's helped a couple people. That is great. That is really great for those people. But there is just not enough evidence right now for us to say either you do have immunity or you do not. Brand new virus. Whether plasma is going to be a major tool in it. I know it's going to be a tool because when you have somebody who's really, really hurting, you're going to be willing to try things, or whether the anti-malaria drug or any of the others will work. Eleanor.
The United States has surpassed Italy for the highest death toll.
Yeah.
What was your feelings, obviously, seeing that?
The question is, the United States has passed Italy on the highest death toll. What are my feelings? It's sad. It hurts. I believe that this is the greatest nation that the world's ever seen, and we ought to have the greatest healthcare system. I think we try, but it's hard because while I always talk about Team Kentucky, we're all also Americans, and this loss is substantial, but the way we've responded is substantial too. So you look at having 20,000 deaths, but that we have restructured our economy, and every single American is making sacrifices right now to prevent more deaths. A lot of what we see today is based on actions from 2 weeks ago. I believe that there have been significant actions taken across the country, and hopefully, we will eventually see our deaths not increasing by the day, but decreasing. But this is uncharted territory for all of us, and this is something that is going to leave lasting scars on this country and on this Commonwealth, both for those that have lost somebody, but we've all already been scarred through this in various means. I hope we come out of it committed to making sure that we are better prepared the next time we do this, and I hope we also come out of it more appreciative of our everyday heroes, of those minutes with our families, of our seniors, in facilities who shouldn't be forgotten. I hope we come out of this. We'll be hurting, but I hope we come out of it better. Phil.
Judge Justin Walker ruled today, Governor, that Mayor Greg Fisher criminalized Easter with his directives on drive-in services. Number one, how do you feel about that? And number two, are you worried that the federal courts could curtail measures you and others are taking to mitigate COVID-19?
So the question is, in Jefferson County, a judge ruled against a prohibition on drive-in services for this weekend. I've been in favor of drive-in services, a chance for people to get together and to worship while being apart. Now, I've talked about the rules of it. They're very important to do so that we can keep doing it forward. And we've had great buy-in from our faith community around the state. And what it told me is if there was a way, some live stream and some do other things, that they wanted to help and protect their flocks. So one family per car. If you're not living the family, don't. So one time we're going to say don't carpool. When we're all done with this and we want to conserve gas and energy, carpool, but don't carpool now. No getting out of the car. This is really the most important one, and no passing things in and out of the car. We've had great compliance. We've had churches working really hard on that, and we appreciated it. Now, we have a county judge in the West and the mayor of Louisville that went a step further, and I don't criticize them at all. In fact, I was supporting them for it based on the density of Louisville and the fact that I think when I looked the other day, they were close to 30% of all the COVID-19 cases in the state. I mean, hit really hard. And I believe our local leaders have earned flexibility. But the fact that the court has ruled this way, again, if you're going to hold one, just follow those rules and make sure that you're doing it. And I know that there's this active lawsuit going forward. I'd like to think if all the rules are followed, maybe everybody can work it all out. Remember, though, that ruling doesn't say it's okay to have in-person services, and that's not what the church who sued was trying to to do, and I think that's important. It doesn't concern me about the orders we've taken thus far. Another federal court has upheld the healthy at home type of order that we have. It breaks my heart that we cannot be together in an in-person service this year. I know I've said this a bunch, but my son was supposed to be baptized this Sunday, and he was going to classes for it. I'm so excited for it. I mean, he's the loudest member of his kids' choir in church, which is okay because he can sing. I cannot, but he can. I mean, he plays handbells. I mean, I love my church, but he is like a living, breathing part of it in a way that I wish I could be. And he's not getting this day yet that he was looking forward to. But he's showing that same grace with the heart that he has, saying if it helps other people, he's willing to wait. And that's what we've all got to do. We've all got to be willing to wait, to be back together again. Again, we're not talking about years. We're talking about months. And we want everybody there at Christmas. We want everybody there at Christmas. And if we get together for in-person services right now, they won't be. Do I have a perfect answer for trying to do the right thing? Probably not, but I'm just doing everything I can to save lives. Okay, a second employee at UPS's Worldport has died from the coronavirus, according to a daily work memo shared with employees. What's your message to UPS workers concerned about the virus spreading? Many say they're not getting the protection they need, like adequate amount of masks and gloves. Well, any facility that has people close together, the type of equipment that can help keep you safe is really important. The type of cleaning that we ought to see is really important. And I hope that there is an ongoing conversation with management every day about that. So I want to take that part. But I do also want to mention that we do our work, and we may be worried about how close we are to somebody, and that is the right thing to question. But we can't question that and then go into a break room and all sit around the same table. And that's not to cast blame on any individual, but we just got to make sure. We got to make sure that our work is safe, not just in what our employer set up, but how we also interact with each other when we're coming in, when we're eating lunch. I hope nobody's smoking, especially in this worldwide pandemic. But if you are during that break, we've actually seen in some state facilities some potential problems in that. Let's make sure. Let's make sure, because the virus is everywhere, that we both get our employers doing the right things and that we also do the right things as well. Where was I? Shelby, you have one more?
Sure. You said that small business insurance doesn't apply to the pandemic because it's an act of God situation. Ohio just passed a change that saying it isn't an act of God because the state leaders made that decision. Do you have any plans to change your initial decision on that?
Small business insurance, I'd have to look at that decision, make sure that I know exactly what you're talking about, because we want to make sure that we're protecting people. Eleanor? No? Phil?
Governor, there have been many folks, I think of Councilman Anthony Pigiantini in Louisville, who have said we need an exit strategy, an exit ramp of some sort. Is it too premature in your mind for us to be talking about that, or have you begun, your administration begun, whether internally or externally, to ask about and talk about what does it look like for us to get back to normal? I know a few weeks ago you told me even when things get better as far as numbers, we're still going to have a lot of these social distancing rules. When in your mind do we begin to talk about an exit strategy of things getting back to normal?
Question is about folks asking about an exit strategy, and there are folks who are really asking about it, and there are folks that try to fill up social media for other reasons. But exit strategy is something that we're obviously talking about and working on, and anybody who tells you in large part that it's not going to be driven by the federal government isn't being honest with you. We're going to have a huge budget deficit here and with Jefferson County. There's going to need to be stimuluses to business and individuals. I mean, how do some of these restaurants, for instance, restart with their debt and pay their rent and bring back employees? And so we're working on a lot of those pieces. We're going to be able to make some early payments to hospital systems, which are also dealing with all this next week, and we're going to be able to talk about that, and then working on different creative ways there. So we're working on exit strategies, but let me say this. Talking about that publicly and going through it before we've even peaked, starts telling people that they can lessen the actions that it takes to reduce the coronavirus. We haven't reached our apex, and the way down. And sometimes the talk about an exit strategy suggests, oh well, once we've done that, everything's going to be fine. That's not the way it goes. When we flatten the curve and we save lives, we'll peak and then we'll level, and then we slowly decrease. That's the way that we save lives and preserve our healthcare capacity. And so coming out of it is going to take a couple of things. There are some people who are talking about exit nationally. What they don't tell you is it all depends on there being a huge amount of testing capacity. So loosening up restrictions requires the amount of testing to be able to widespread test across our state or across the country. And then it requires, it'd be the thousands of people to be able to contact trace and to isolate from each of those tests. So it's going to be a real feat. But when we come out of it, it's not as easy as we help this group or that group. It's that different groups are still more susceptible to the coronavirus than others. And so we're going to have to look at, is there different timing for different age groups? I know that's hard to hear, but when you look at the virus and how it works, it is probably a reality. And then what restrictions are released at what time? It's got to be a very gradual, incremental way that we exit and that we rebuild. And remember, in so many of these models, there is a re-spike. And so there is a chance, though I hope we do this right the first time, that as we come out of it and loosen something, we may have to restrict it again. They talk about fall spikes in some of these ordeals. My commitment is I just want us to be singularly focused at defeating this coronavirus. I mean, just look at what it's done to nursing homes over the past 4 days that we've talked about it. I mean, the folks in those nursing homes don't want to hear about our plan on the exit strategy. They want to hear our plan for saving their lives, and that's what we're gonna keep talking about. So I came into this job wanting to do a lot of things, having a lot of different focuses. This coronavirus is my only focus, other than those that I have to do by law, which means also a budget coming out Monday afternoon, going back to the legislature. Anybody else? All right. Thank you all, Kentucky. It's a special weekend, and I want to thank everybody that's out there. I know I made a couple of headlines yesterday about those that aren't complying. That's again, I talked about it's 0.01%. And what hurts about making those is that it ought to be about all of you that are out there making the sacrifices that you need to make. And when I make tough decisions, part of it is to honor your sacrifices. If you were doing the right thing and you were staying healthy at home, I want to make sure somebody else's decision doesn't infect your family with the coronavirus. That if you were doing the right thing, that somebody else's decision doesn't end up killing a parent or a grandparent in one of these nursing facilities. I'll tell you, like all of you all, it's hard. And I hope I make the right decisions every day, the ones that lead us in the right direction. But I'm making them with my heart. I'm making them based on my faith. And Kentucky, I've never been prouder of you. This weekend, all last week, and I know next week, you are rising to this challenge, and we're going to win. And we're going to lose some people along the way, and it's going to get harder before it gets better, but we're going to win. And I can say that because I already see what you are doing. You are out there every day beating a worldwide pandemic. And that's a pretty amazing thing. It's because of the quality of people that you are, and it's because we care about each other. So let's have a special weekend. And tomorrow, it being Easter, I'm going to do about 30 minutes. It's going to be really short. And I understand for a lot of you not tuning in, and that's okay. We will have what I think is a real positive testing announcement tomorrow, but we're going to be really short. So have an amazing weekend. Let me tell you early, happy Easter, happy Passover. We will do this, Kentucky. I so appreciate you. Thank you. Thank you.